Hi, my name is Emily Bach. I'm a women's health nurse practitioner student at Regis College, and this is my head and neck assessment for NU 650 Advanced Health Assessment. And this is my mom, Evelyn. She's going to be my assessment buddy. I consent to be in this video. Do you consent to be in this video?
I do.
Okay, so starting with the head. Your head is an average size, facial expression is neutral. Any areas of like tenderness when I'm touching?
No.
Okay, so she has a normal cephalic atraumatic head. Moving on to her eyes. Her eyes are symmetrical, eyelids, eyelashes are all intact. She has, you don't really, any tenderness?
No.
So no tenderness, no excessive tearing or dryness, or no swelling. I'm just gonna take a look at your, I'm gonna have you, no, look straight ahead, good. So sclera and conjunctiva are white and clear with normal vasculature. Having you look at me, I'm gonna use your phone. Looking straight ahead. So pupils are reactive to light, and both reactive to light. And then I'm gonna have you follow. So look at my finger and then look behind me. And again. So pupil constriction. And then I'm gonna have you follow my finger with your eyes, but don't move your head. Extraocular movements are intact. Next, I'm going to take a look at your eye. So your iris, cornea, and lens are all symmetrical and intact. Your pupil size is around 4 millimeters. Red reflex is intact. I can see the optic disc and the retina, and then the fovea and macula. I'm going to have you cover one eye and read the smallest line to check your visual acuity.
The smallest line that
Yeah.
I can see?
Yeah.
LTFPH.
Good.
Other?
Nope.
Okay.
So eyes we've done. So next what I'm going to do is the ears. So I can see that your ears, the outside is an appropriate color, intact, symmetrical bilaterally without any lesions. Any pain when I touch here?
No.
What about here?
No.
Good. So first I'm going to look at your ear canal. So first I'm going to begin by inspecting the ear canal, which is free from redness, swelling, and any foreign bodies. Next I'm going to look at the tympanic membrane, which is, I can see the cone of light and all the pieces. It doesn't look like any swelling or any lesions. Good. Next I'm going to do the whispered voice test. I'm going to have you occlude one side, and I'm going to whisper a combo of letters and numbers to you, and I want you to repeat it back to me. A3B.
A3B.
Good. Next I'm going to do the Weber test. Can you hear that? in both ears equally?
Yes.
Good. Next, the Renee test. Tell me when you can no longer hear the sound.
It's gone.
What about now?
Oh, I can still hear it. Yeah.
Good. So air conduction is greater than bone conduction. Next, moving on to the nose. So your nose is symmetrical bilaterally, no lesions or drainage. I'm gonna have you occlude one side and then breathe in. Good. No obstruction. The other side. Good. Now I'm just gonna take a look inside. No perforated septum. Appropriate color, no lesions or drainage. Same thing for the other side. Next, moving on, I'm going to palpate your frontal sinuses. Any pain or tenderness?
No.
And your maxillary.
No.
Next, I'm going to move on to your mouth. So your lips are pink and moist, no cracking or lesions. Can you open your mouth? And your teeth are intact. Your mucosa looks good. It's pink and intact, no exudates or drainage. Your teeth and gums look healthy. There's no bleeding or drainage. Next, I'm gonna have you say ah.
Ah.
Good. Your tonsils are nice and clear. No exudate or swelling. They're +1. And your uvula raised. Good. Next, moving on to the neck. So inspecting first, your neck is midline. I'm gonna palpate your lymph nodes. Occipital. Good. I'm just gonna feel your trachea. It's midline. And then your thyroid. Go ahead and swallow. Good. So it's firm, non-tender, and I don't feel any nodules. Okay, that would conclude our head and neck, eyes and ears and nose exam. Thank you.